All right, in this explainer, we're going to tackle a massive question that every hospital board is wrestling with right now. And, the answer might just be hiding in plain sight.
So how do hospitals save money without, and this is the key part, cutting care? It really feels like an impossible choice, right? You either have to improve your finances or you invest in patients. But what if that's a false choice? What if there's another way? What if the real key isn't about less, but about being a whole lot smarter?
And believe it or not, the answer, a huge part of it anyway, is hiding in the supply chain. We're talking about recovering somewhere between 8 and 15% of supply chain costs. Now let's put that in perspective. For every single $1 million a hospital spends, that's up to $150,000 just gone, wasted on pure inefficiency. This isn't just a small fix. This is a massive lever they can pull.
So here's how we're going to break it down. First, we'll look at the financial squeeze that's happening across healthcare. Then, we'll go on a little hunt for the hidden world of waste. After that, we'll talk about how consolidation can save millions, the cool tech that's making it all happen, and finally, how smarter spending actually leads to better care.
All right, let's dive into our first section, healthcare's financial squeeze. There's a real and urgent need for a new way of doing things.
So here's the fundamental problem pretty much every hospital is facing. The cost of labor, paying their amazing staff, is going up. But the money they get back for providing care, that's staying flat. It's this exact pinch that's forcing everyone to get really creative and find savings in places outside of direct patient care.
And that pressure, well, it shines a spotlight on this huge, often invisible opportunity. We're talking about tackling the hidden world of waste, where millions of dollars just disappear.
No, we're not talking about someone leaving the lights on. These are symptoms of a much bigger, fragmented system. Think about it. You've got dozens, sometimes hundreds of vendors. You've got contracts that are totally siloed, so one department has no idea what another is paying. There's basically zero visibility into the total spend. And this leads to something called maverick spending, which is a great term. It's like, a department head who just has to have a certain brand of gloves, so they buy them from their old favorite vendor instead of the hospital's approved one, probably paying way more and creating a whole separate invoicing headache. It's just a recipe for inefficiency.
But, all that chaos actually points us directly to the solution, and it's a really powerful idea called procurement consolidation. This is how you take that mess and turn it into actual dollars saved.
So what is it exactly? Well, at its core, it's all about taking all those scattered, disconnected buying activities from every single department and bringing them together under one roof. It's about creating a single coordinated system that runs on data. Basically, it's the difference between 1,000 people shouting in a marketplace versus one single powerful buyer negotiating a great deal. And this involves a few key moves. First, there's vendor rationalization. That's just a fancy way of saying you work with fewer, better suppliers to get way more negotiating power. Then there's contract standardization, which just means making sure everyone in the organization gets the same good price. And of course, you use modern tools like spend analytics and even AI to see where the waste is and predict what you'll need in the future. Pretty smart, right? And the results can be, well, immediate. You do a quick audit and you find out, and this happens all the time, that the health system is buying the exact same stuff from 5 different vendors at 5 wildly different prices. Just by cleaning that up, you can cut down on the number of duplicate vendors by a massive 20 to 30% right off the bat.
The other giant win? Admin overhead. Just think about all the human hours, people's valuable time spent pushing paper, processing manual purchase orders, chasing invoices, getting approvals. When you automate all of that with a single platform, you can slash those administrative costs by a jaw-dropping 30 to 40%.
Now, a change this big isn't just about having a good strategy. It's really being powered by some incredible technology, the kind of tech that's finally making its way into the nuts and bolts of how hospitals are run.
And this really shows you the before and after. We are literally moving from the old way, manual purchase orders, reports that are a month old by the time you see them, systems that don't talk to each other, to a new way with automated workflows, real-time dashboards, and one integrated platform. You get a live, up-to-the-second view of your financial health.
What we're really talking about here is fintech, financial technology. We all use it every day with our banking apps. The idea is simple. Use digital tools to make financial stuff faster, smarter, and more transparent. So think about getting that instant spending alert on your phone from your bank. Now, imagine applying that same power, that same instant visibility, to a hospital's budget that's worth millions and millions of dollars. That's what we're talking about here.
So here's the bottom line.
When a hospital brings in one of these intelligent procurement platforms, they're not just upgrading their supply chain, they are giving their entire financial operation a modern-day overhaul.
And all of this leads us back to the main goal, right? Smarter spending for better care. It's about building a financial future for healthcare that's actually sustainable.
And look, this isn't just some high-level idea. There is a clear roadmap to get it done. You start by doing a full diagnostic on all your spending. You find the biggest opportunities for consolidation. You prioritize them, you pick the right tech platform to help you, establish some rules, and, this is key, you track everything to prove that it's actually working.
And I really want to drive this point home. This whole process is about targeting inefficiency in the back office. It's not about clinical resources or patient services. It's about being smarter with the money that supports the care, so the care itself is never, ever touched.
And this quote just says it all, doesn't it? Boards are not finding margin by cutting care. They are finding it by transforming the operational and financial infrastructure that surrounds care delivery. A healthy bottom line isn't found by taking things away from patients. It's found by revolutionizing the back office. The real win here is building a smarter financial engine that can support the amazing work that happens on the front lines. So really, the question isn't if health systems will do this. It's just a matter of when.